Abdominal and pelvic swelling can be caused by various things, including lymphedema or surgery. My name is Kelly and I am a physical therapist that specializes in lymphedema, the lymphatic system, as well as oncology. In this video, I'm going to show some of the best exercises to do to help to decrease swelling in these areas. If you'd like to see these as a handout that you can print out or looking for others, you can find these on my website, which I'll link up above as well as down below. Also be sure to subscribe down below for weekly new videos, and you can also follow along with us on Instagram for more related content. So these are exercises that are safe to do when someone is cleared by their doctor to do them. Especially if someone had surgery or an infection, we want to make sure that we get clearance first. For many of these exercises, being consistent with them, doing them 1 or 2 times a day over the course of multiple days or even weeks, is important to see some sort of change. Now, if someone has lymphedema or a chronic condition, they also may need months or years of consistency to manage their side effects. These exercises may be done any time of day. Doing them 10 or 15 times, or 10 or 15 of each movement, is a great number to do. There should be no pain involved as well. So if someone has pain, we want to make sure that we stop right away. There will be some exercises laying down and there'll be some seated or standing, just to give various options. But sometimes it's best just to pick 2 or 3 that works for someone and start there. So one of the best things that we can do for swelling in the abdomen, the trunk, and in the pelvis area is to do deep breathing. So I like to do this laying down. This can be done sitting up, but what we want to do is you can gently place your hands on your belly. We want to gently press inwards towards our hand to give some overpressure there. Then we're going to take a nice big breath in, really putting the breath right through the belly, feeling that resistance with the hands. So gently hold the hands there, take a nice big breath in into your hands. And as you let your breath go, gently let it relax. Making sure you keep some tension with your hands. And we'll do that 3 more times. Big breath in and out. Good, you can do 2 more on your own. If you're having a hard time managing this, you can also put 1 hand on the chest, 1 on the belly, making sure that you're feeling the belly move and not necessarily the chest. So that allows us to do the belly breath. So 1 more big belly breath and out. Another exercise is going to be trunk rotation, so laying on our back with our knees bent, our feet underneath us. What we're going to do is allow our knees to fall over to one side. We'll use our core to come back to the middle and then allow them to fall over to the other side. Going back and forth, making sure that you keep everything gentle. So if someone has any pain, either decrease the range of motion, so only going a couple inches rather than all the way over. If you still have pain, then I would stop completely. But going back and forth, we also want to make sure that we don't arch into the low back. You really keep your core somewhat engaged the entire time. This will help stimulate the muscles in the area, stimulate the core muscles to get that fluid moving. Going back and forth, I like to do 10, maybe up to 15 on each side, but alternating. Okay, so for another exercise we're going to do marching in this position. This can also be done in standing. It can also be done in sitting. I just like to add a little more core activation here. So in the same position that we had been for the other exercise, keeping our core engaged, just lifting 1 knee up, controlling down, lifting the other knee up, controlling down. This is pretty easy, nice and gentle, but you are going to be activating your core with this, as well as your hip muscles, your pelvic muscles as well. So making sure that you stay engaged, that you're not allowing your back to arch up, and you're just marching back and forth with control. Alternating 10 to 15 times. Another exercise we can do are bridges. So with our feet underneath us, about shoulder or hip width apart, we're going to be lifting our hips up off the mat. We don't want to arch into our back. We really want to activate through our hips. So keeping our core nice and engaged. When we're ready, we're going to lift our hips up. A couple inches is fine. You can go a little bit higher. You just want to make sure you're not going so high that you're arching into your low back. You only want to go as far as your hips swell. So keep the core engaged, lift the hips up, and control down. lift the hips up, control down. Someone can pause at the top for a couple seconds, but the idea is to get some sort of movement through the hip muscles and the pelvic muscles in the core. So going up and down 10 to 15 times, nice and gentle. And then one more exercise laying on our back. This one's going to be a little bit more challenging. So this one might be more of an advanced exercise for some individuals, especially if they have any back issues. This one's going to be where you're going to take your hands, you can grab both knees. Just remember, if you bring your knees closer toward your head, it's going to be easier. If your knees go further away from you, it's going to be harder. We want to make sure that our back stays in contact with the mat or the floor the entire time. So we need to scale that. If our back comes up, we need to bring our knees in closer. But what we're going to do in about 90 degrees that our hips and our knees are close to it, we're going to take one heel and tap it to the ground or the table or the bed, and then alternate back and forth, making sure our core stays engaged the entire time, and then we're not arching up. If the back arches up, we've got to bring our knees in closer, and if it still arches up, then this exercise might be a little too challenging for where someone's at. But alternating back and forth, toe taps or heel taps, keeping the core nice and engaged. It's a great core exercise, it's a good challenge. We can also do what I call a ballerina stretch, where we take our hand, grabbing the opposite wrist, pulling up and over to our side, and then switching, grabbing the other wrist, pulling up and over the other direction, moving back and forth, getting a nice stretch down the side of the body, alternating side to side, 10 or 15 times. We can also finish with rotation with our core by taking one hand and tapping either the opposite knee, or if someone has more mobility, opposite shin or opposite toe, getting some rotation. So really focusing on getting rotation in the core and the trunk, getting that twist involved, alternating back and forth to stimulate the core muscles, to help stimulate flow of the lymphatic system, getting that fluid moving from the lower body and the pelvis back up towards the heart. Alternating back and forth 10 times, 15 times on each side. And those are a few exercises for swelling in the abdomen and the pelvis. Be sure to work with a physical therapist in your area for more personalized guidance. You can check out all of the other videos on my channel if you're looking for other exercises or more treatment options for this area. If there's any other topic that you want to see covered, feel free to comment that down below. Otherwise, we'll see you all in the next video. Thanks, everyone.